Hello, Eagle Nation. My name is Patricia LaRose, and I am a graduate assistant for the Office of Student Wellness and Health Promotion at Georgia Southern University. September is Suicide Prevention Month, and the Office of Student Wellness and Health Promotion and the Counseling Center seeks to increase awareness about suicide prevention and how you can play a role in preventing suicide. Suicide is a serious public health problem that can have harmful and lasting effects on individuals, families, and communities. However, with the right tools, education, and resources, suicide is preventable. We all have a role in suicide prevention. Each of us has the opportunity to be that one person who makes a difference, the one person who asks the right questions that could potentially save the life of one who has thoughts of suicide. Pain isn't always obvious, but we do need to know the warning signs. Some warning signs include talking about wanting to die or kill oneself, looking for a way to kill oneself, talking about feeling hopeless or having no purpose, talking about feeling trapped or being in unbearable pain, acting anxious, agitated, or reckless, sleeping too little or too much, withdrawing or feeling isolated, prior history of attempt, family history of mental illness, and so many more. You cannot predict death by suicide, but you can identify people who are at increased risk for suicidal behaviors by knowing the signs, being present, and referring them for effective treatment. The campaign #BeTheOne2 has 5 action steps to help prevent suicide. The first step is ask. Ask, are you thinking about suicide? Asking this question in a direct, unbiased way allows for effective communication about their emotional pain. You could also ask questions like, how do you hurt? How can I help? How can I be there for you? When talking to an individual who may be exhibiting warning signs of suicide, be an active listener. Take their answers seriously and do not ignore them. Help them focus on their reasons for living and don't impose your reasons for them to stay alive. Number 4, keep them safe. There are a few things to know to keep a person with thoughts of suicide safe. Have they done anything to try to harm themselves or kill themselves before talking to you? Do they have a specific plan? Do they know how they would kill themselves? Knowing these answers can help you identify if the individual is in immediate danger. Be there. Be physically present with them or talk to them on the phone. You can be there in other ways to support them, but if you're not able to be physically present with someone with thoughts of suicide, try to connect them with someone who can. Help them connect. One way to help a person with thoughts of suicide is to create a safety plan with a list of resources that can help them when a crisis occurs. A safety plan could even include information about what to do when experiencing thoughts of suicide, and the most important thing is to connect them to professional help. After completing all of these steps, make sure to follow up with the person experiencing thoughts of suicide. Check on them and ask them how they're doing. This is also a great opportunity to see if there's anything else that you could do for them. It's always nice knowing that you have support, and by doing this, you can potentially reduce their risk of suicide. Here are some things to remember, Eagle Nation. Eagles do right when we encourage and support one another, when we pay attention to the warning signs, when we have open and honest communication with our friends about their emotional pain, when we rely on others, especially professional therapists, for help, and when we work together for suicide prevention. If you or anyone you know may be dealing with suicidal thoughts, please know that help is available. You are not alone. The therapists at the Georgia Southern Counseling Center want to work with you to manage these distressing thoughts and keep you safe. Other resources include the Psychology Clinic on campus, the University Police Department, Georgia Crisis and Access Line, the National Suicide Prevention Line, and many more. Remember, Eagle Nation, you can play a role, yes, you, in preventing suicide. Asking the right questions, listening and being present, and connecting the person with thoughts of suicide to the right resources can make a huge difference and possibly reduce their risk of suicide. And if you're experiencing thoughts of suicide, please do not be afraid to ask for help and know that you are not alone. Also, don't forget to follow Student Wellness and Health Promotion at GSSWHP on social media, as well as the Counseling Center. All handles are down in the description below. Eagles do right.